Gum disease is a major cause of inflammation. And quite frankly, I didn't care about my own gums until I started reading the research on gum disease and heart disease, gum disease and dementia, gum disease and depression. And I'm like, I generally think of inflammation in three big things. I think of your microbiome, because when it's not healthy, you have more inflammation. I think of gum disease, and I think of low levels of omega-3 fatty acids. I did a study looking at 50 consecutive patients to Amen clinics who were not taking fish oil, and 49 of them had suboptimal levels of omega-3 fatty acids. We do the omega-3 index in our clinic developed by Bill Harris, and I was horrified by the low levels of omega-3 fatty acids. Well, how easy is that to fix, right? Take a high quality omega-3 every day, supplement, get more omega-3s in your diet, and begin to limit the unhealthy omega-6s from processed food, especially corn and soy. So supplementation, omega-3s in their diet. Gum disease is a major cause of inflammation. And quite frankly, I didn't care about my own gums until I started reading the research on gum disease and heart disease, gum disease and dementia, gum disease and depression. And I'm like, so ultimately became a flossing fool. And even though one of the good things about dying is I'm not going to have to go get my teeth cleaned, I go get them cleaned twice a year, just to make sure I'm on top of it. And then really falling in love with your gut bugs. I call them friends with benefits, that they make neurotransmitters, they digest your food, they help detoxify your body. I think the more we can elevate the microbiome to an everyday discussion, that's just a really good thing to do. You know, do I love my gut bugs? And this is why you don't drink alcohol. What does alcohol do to bugs? It kills them. You know, my wife's a nurse, and why does she put alcohol on your skin? Because it disinfects it. Why, during the pandemic, did Jim Beam make hand sanitizer? Because alcohol kills bugs. So you really want to be drinking 2, 3, 4 drinks every night. What's that going to do to your microbiome? It's not a good thing. Artificial sweeteners like Splenda have some evidence it can damage your microbiome. Pesticides, what do pesticides kill? Bugs. Antibiotics, what antibiotics kill? Bugs. So I think just being more mindful of the microbiome will help decrease inflammation. And I don't know, Dhru, if you've noticed this, but it's autoimmune disorders are rampant. And every night, every Thursday night during the early part of the pandemic, I was on the radio in London just answering questions from callers who were anxious. And I remember this person called with rheumatoid arthritis, and I was on with an ENT doctor. And the host kept going to the ENT doctor about this person's rheumatoid arthritis. And I'm like, hello, psychiatrists are physicians. Why do you have rheumatoid arthritis? That is what you have. It's not why you have it. And if you don't know why, you really can't treat it. And I get really irritated because I have so many patients come in, they have Sjogren's or they have rheumatoid arthritis or something else. It's an autoimmune disorder, which just basically means you pissed off your body and it's now friendly fire. It's attacking itself. And they're not thinking about the simple things like, maybe we should stop gluten and dairy, corn and soy and artificial dyes and sweeteners and just see what happens. And I have all of my patients who have autoimmune disorders keeping journals on, okay, which foods make me unhappy and which foods make me happy. And it's so simple.
simple. And when you invest in your body and you also invest on identifying those dragons of the mind, a lot easier to keep your focus on those things and have longevity, because people get derailed. When you put people on a plan, or when you see people pick up your book and actually read it, what would you say would be the most common reasons that you find, uh, even if you talk about them and sort of help people know in the context of the conversation, what are the common reasons that people get derailed that you see from following through with a program or plan?
They're not really clear on the why of what they're doing. Because I find if you don't really know why, you won't do what. And, people go, so what do you think's one of the secrets to your longevity and success? And I have an exercise I do for my patients, but I always do it for myself, called the one page miracle. It's on one piece of paper. I write down what I want: my relationships, my work, my money, my physical, emotional, and spiritual health. What do I want? And so I'm like always crystal clear. And I think people should run their lives like really great CEOs run businesses. And it starts with, so what's your mission? And how are you going to get there? And what do we have to do day in and day out to do that? And it's that level of clarity that prevents people from getting off track. So if I know, for example, I want to have a kind, caring, loving, supportive, passionate relationship with my wife, I inhibit a lot of the stupid things I think. I don't let them out of my mouth because it won't get me what I want. If I know I want to live until I'm 100 with my brain intact, that if I want to live with energy and clarity and good decision making, like I love my 4 children, I never want to have to live with them. I don't want them dressing me, changing my diaper, feeding. No, I want to be independent. And if I know that, I'm going to be making better decisions and I'm going to stick with it. And too often people start because they're like, okay, my jeans are too tight or I hurt, but they don't really have the complete picture in their head of why they're here and how they want to live the rest of their life.
And what you want changes in different age ranges that you're in. What's something that you want now, being a young 67, that is new for you, that's a priority in your life, either based on your environment or based on the health goals that you have today? Something that you want now that maybe you didn't have at the highest level of priority. Not that it wasn't a priority, but it wasn't at the highest level of priority in the past.
Well, I love grandbabies as opposed to wanting babies. I don't want babies anymore. 10 and I last year ended up adopting our 2 nieces who are now 11 and 16. And they're the last babies for us. We love them, adore them. But, I sort of want mostly the same things: energy, meaning, and making a difference. I guess I could retire, but to do what? I love what I do so much. Like just having this conversation with you just makes me happy to learn and to give that to other people. At my age, you begin to think about, how do I get this to live beyond me? And so I love training other doctors to do what we do. One of our big goals, and it's also one of the reasons why I want to live a long time, is I want to change how psychiatric medicine is practiced. I think psychiatry has completely lost its way. And, when I trained, we were sort of primary care doctors for the mind. We'd see our patients for an hour or two, or sometimes 3 or 4 hours a week. We'd really get to be involved in their lives. And, um, and now psychiatrists have become prescribers. You go to somebody else for the therapy and we'll do your medication. It's complete nonsense as far as I'm concerned. Plus, most psychiatrists never look at the brain. So, I mean, we really haven't talked much about that, but psychiatrists are the only medical specialists that virtually never look at the organ they treat. And for 30 years, I've been looking and sort of like the wolf crying in the wilderness, scan your brains, scan the brains of your patients, because if you don't look, you don't know. And, I've had that goal to change my profession. And just in May, the Canadian Association of Nuclear Medicine came out with procedure guidelines for SPECT as if I wrote them. In fact, of the 10 authors for the guidelines, 5 of them had been my students. And that made me super happy. But, if you're going to change a medical specialty, it's going to take a long time and a lot of effort. So training other doctors to do what we do is a high priority for me.
I want to jump back over to the practicalities on things. And I think there's a lot of people that are asking this question when you were chatting about some of the topics earlier that I'm going to bring back. On the topic of alcohol, so is it that you don't drink at all? And then with your patients, are you telling them, in addition to your thoughts, that, look, I'm recommending not drinking at all based on everything that I know and put together? Is there another part of you that says, okay, great, if people are going to drink, here is the max limit, or here is the better options that are there? So just a clarifying point from your perspective.
So I don't drink at all. I don't ever like not being mentally clear. And
could I interject 1 second just to clarify that? Has that always been the case, or did that change at some point in time in your life?
I got drunk when I was 16 and acted badly and felt badly for a couple of days. Tried it again when I was 21, and I'm just like, I don't get it. Just never really got it. And then when I saw the scans of my alcoholics, I'm like, well, that's horrifying. And then I just sort of followed the research. And my biggest blog last year was called I Told You So. And I started the blog with, when I was dating my wife, she told me, I will never tell you I told you so. And she lied. It's like her favorite thing to say. And for 30 years, I've been saying alcohol is not in your best interest. You can imagine, as a psychiatrist, I see a lot of couples with domestic violence and people who make bad decisions, and alcohol is involved in a very high percentage of cases. But last year, the American Cancer Society came out against any alcohol. Imagine that, a political body like that. And they said any alcohol is associated with an increased risk of 7 different kinds of cancer. And so if any alcohol shrinks your brain, study from Spain recently, destroys the white matter in your brain. I published a study showing it prematurely ages your brain, and it's associated with cancer. Chemotherapy is not good for your brain. If you're sort of a drinker and your brain is super healthy, what am I going to say? Most of the people who come to me, their brains are not healthy. And I'm like, oh, well, we need to rehabilitate your brain. And during this time, until your brain is really healthy, I would prefer you not to drink. If you're going to drink, maybe 2 glasses a week would be sort of okay. So that's generally what I tell my patients.
And again, I'm not a big drinker. I had very sort of liberal sort of parents growing up that said, here's the reason why we don't drink. But they understood that the more you try to control kids, the more that sometimes there's backlash. At least when it comes to alcohol and the the American approach versus like, let's say like the European approach. So I never really had a draw towards it. I drank a little bit, like I had some, like I think I had like a beer once in high school, didn't even finish it. And in college a little bit, had like a couple, cocktails and things, but it was mostly as an excuse of like, I'm out dancing, I'm hanging out with my friends, we're all having fun together. And so I never really got into it, but I know that people who, and later on in life, I got a little bit into wine more as just an appreciation. I actually prefer to taste it rather than drink it. I'll take a little sip and I have no problem spitting it out because I don't really enjoy that aspect as much as I just do the taste and, developing that palate. So when you say a couple glasses a week, because I know people are thinking about this distinction, are you steering them towards certain alcohols versus other alcohols?
No, they're all equally problematic for you. So, and it's very important from a clinical standpoint to actually get a really good history of how much they're really drinking, because they'll say, oh, I only have two or three, but you realize they're two or three big glasses. So they actually might be considered 8 or 10. So I think history matters. I was in the military and spent 3 years in Germany, and they have these huge beer steins. So whenever someone says, oh, I only have 3 glasses, my next question is always, how big's the glass?
It's a good question.
Yeah, and ultimately, it's about love. And I think a lot about teenagers. I'm also a child psychiatrist. And we developed a high school curriculum called Brain Thrive by 25, and it's in all 50 states and 7 different countries, where we teach kids to fall in love with their brains. And invariably, during, I think it's week 6, it's like what to avoid. And, like marijuana and alcohol and not sleeping, bad food. And invariably, it's a boy. And it sort of frustrates me that it's always a boy that raises his hand and says, how can you have any fun? And then we play a game with the kids called Who Has More Fun? The kid with the good brain or the kid with the bad brain? Who gets the girl and gets to keep her because he doesn't act like an ass? The kid with the good brain or the kid with the bad brain? Who gets into the college they want to get into? Who has the most meaning and purpose throughout their life, which is truly associated with happiness? The kid with the good brain or the kid with the bad brain? And we had an independent group study, Brain Thrive by 25, decreases drug, alcohol, and tobacco use, decreases depression, and improves self-esteem. It's not effective to say you shouldn't do this. It's really effective to get them to fall in love with their brain and then to take care of it. And I find youngsters today, teenagers, and kids in their early 20s are very interested in their health. And if they know why, they're more likely to do what is helpful for them.
As always, education and true cost benefit analysis is the best way to empower people, because you're not shooting anybody. You're just saying, hey, this is action reaction. You go down this route, take this action, this is the reaction. Go down this route, you take this action, this is the reaction. And I find that I don't have kids yet of my own. I look forward to it in the future. But just remembering being a kid, I always felt a lot more trust with adults who would speak to me that way versus, superstitions or whatever else were the pressures that were being used to have you form in a manner that matches their societal beliefs. On the topic of teens and kids, you mentioned something earlier. You said one of the dragons is out there is comparison. And you said, a lot of kids these days are suffering with it. And I think a lot of adults are also suffering with it. For the dragon of comparison, each of the dragons that you've listed out, they all have different interventions or things that you can look at. What do you think about when it comes to comparison, which is something that so many people, including teens, are dealing with today? as a dragon in their life that's running the show, and how they can get beyond that dragon?
Well, to know it's a trap, and that the more you do it, the worse you're going to feel. So notice when you're doing it. And I remember during the Olympics, because, I've been blessed. I've seen a number of Olympic athletes, and most of them have been pretty unhappy because they live with the inferior, flawed dragon, even if they're the best in the world. I mean, we saw this play out recently with Naomi Osaka, that she's just started the US Open, and she came out. She said, I always live with the thought that I am not enough, right? So, one of the best in the world. And what I wrote was, it's very important not to strive to be the best. Because if you strive to be the best, you have to put other people down. You have to be better than other people. And that's a prescription for unhappiness. If you strive to be your best, well, you can take people along with you. You can elevate people with you. And that's a prescription for happiness. And I learned this when I was a college student wanting to go to medical school. And, that could be like a dog eat dog world where, I have to sort of poison someone else's experiment so they won't get the good grade and I'll get a better grade. And because of my religious background, I just thought that was awful. And I'm like, no, I want to do well, but I'm going to help you do well too. So I would always sort of organize study groups where, and I always did really well in college, but it's like, how can I help you be better? Because every time I helped you be better, I was better, right? Because it just reinforced what I learned. And so I love collaborative competition rather than I have to be better than you. And it's that mindset that will just help you soar. If you help other people, like, Mark and I been hugely supportive of each other's work over the years. And, I always want my shows on public television to be best, but I want his to be best too. And if we both do great, well, that makes us happy. How can I support him? And he's like, well, how can I support Daniel? And that's the best way to be, because you're elevating everybody.
I really wanted to be very straightforward of looking for what nutrients are most related to the most disabling illness in the world, which is depression. And by extension, as depression and anxiety kind of weave together, what can we learn about the most important nutrients? And there are 12 of them in the literature that really stand out. Iron is one of them. Zinc is another. Omega-3 fats are another. B12, a lot of nutrients that we hear about. And by strongly related in the science, meaning there's strong correlational data. You don't eat enough iron or you have an anemia, you get real significant depression and mood problems and anxiety problems. And then also treatment data that, for example, if you give people an iron supplement when you treat them with antidepressant, they get better faster. So when we found the nutrients, those 12 nutrients have both of these kind of types of data around them. And then I always want to illustrate, like, what does this do in your brain? Because that's my business. Brain food is my business. Your brain is what I'm trying to change. And iron is so interesting. One, just your brain requires so much oxygen, right? And so part of keeping a healthy vascular system and having healthy red blood cells is the transport of oxygen. The other is that iron is involved in the biochemical pathways that make those brain chemicals lots of people have heard of: norepinephrine, dopamine, serotonin. It's a cofactor in those chemical reactions. And so I like people knowing a little bit around how these nutrients function in our brain, because I think that connection helps us make those choices. You're not just eating fish because some expert says so. You're eating fatty seafood because you have a knowledge about why EPA and DHA, the long-chain omega-3 fats, are absolutely vital to healthy, vibrant brains. I just think that empowers people. I mean, that's the point of sharing this knowledge, I think, is mental health. Sure, if you need help from an expert like me, please come. That's what we do. We're good at it. It's getting treatment in mental health might be hard, but getting people better in mental health settings, I don't think is that hard. We have a lot of resources, but I think people really need to reprioritize and focus on their mental health and mental fitness and how to really achieve that every day. So high iron foods are part of that, like foods that have these other nutrients are part of that.
Yeah. And give us a couple high iron foods that are part of your favorites that you want.
Yeah. So my high iron side. So when I talk about iron, I love, one of my favorite high iron foods are clams, because clams are also one of the top foods for vitamin B12. They actually are the top vitamin B12 containing food. I love some of the plant-based options. Cashews are the nuts with the most iron, and nuts are something we're always snacking on in our house. My wife and I, we've got a couple of kids, 10 and 7. And so we do a lot of traveling. We're kind of partially nomadic. And so we've always got a bag of like raw cashews or raw almonds with us. Another surprising high iron food for people are things like liver. One of the reasons that a lot of folks are looking at traditional diets and offal meats, organ meats, is just they're very nutrient dense. And then pepitas, pumpkin seeds, that's one of my favorites, just because I'm always putting those in my pesto, for example, or dropping those in salads. Again, it's a plant-based form. You don't absorb quite as much, but the point is to get a lot of nutrient density, and you want a mix of plant and animal iron sources.
Now, you grew up vegetarian, as you mentioned earlier. So did I. I was a very processed food vegetarian, except for the one home cooked meal that I would eat at night at dinner when my mom was making like healthier Indian food. And in the book, on the topic of iron and then connected to muscles and seafood, you share about how seafood, you started reading the literature on these omega-3 fats and how important they were for the brain and the building blocks of much of the brain. But it was hard for you to come around to actually enjoying seafood. Tell us about that story. And then what did you actually do for anybody who knows that seafood is good, but maybe isn't eating enough? What are some tips and tricks from the doctor himself?
For sure. And thank you for that question, because I really do try and walk the talk. I don't want anybody to ever eat food they don't like. And I think that means really challenging us to expand our palates and understand ourselves as eaters. There's a chapter in the book, Eat or Heal Thyself. I'm really asking people to transcend a lot of the dietary trends and a lot of the kind of quote unquote expert advice. Really think about yourself as an eater. And I had never grown up with seafood. Funny, I remember when we moved to New York City, I had this realization. It's like, I guess this is a town with a lot of seafood because we're by the sea, living on an island. And it's like, hadn't struck me, right? Like New York is like pizza. It's like, no, it's a great seafood town. So the data came out. I didn't eat food. I was looking for more protein sources. And so there was a friend we had, Beth, who was a chef that was working. She was freelancing for Martha Stewart's team at the time. And we were at a party and I kind of told her about this data, and she's like, you should just try a whitefish. I still remember it was like this little apartment in Waverly Place down in the West Village. And she said, put a lot of lemon on there, put a pat of butter, maybe a little lemon zest. You need to sprinkle some breadcrumbs, slide it under the broiler for 7 minutes, 10 minutes, see if it flakes apart. I remember being so terrified it was going to be undercooked. Right? This whole until it flakes with the fork. It's funny. I've never, ever worried about that since I've become comfortable with seafood. I think it just shows us how our fears get in our way, right? Somehow I'm going to mess this up and it's going to poison everyone. It's like, no. So I started experimenting like that. Then I started some really strange things. Like I loved, oddly, bacalao fritters, salt cod, and fish and dipping sauces. And then I realized, I'd always eaten a little seafood. I liked sushi, just a couple things. And so my first steps, and this is how we work in our clinic, in the brain food clinic, is really to think, not that I need to start like grilling seafood and making all these fancy things, but just what's our little things I can do? Like at a sushi restaurant, can I try a new type of seafood? And also, I think a really important challenge for us is, can I ask for help in that? Right? Like, hey, I'm new at seafood, and is there anything on the menu? I remember I was once in an event and there was a man from Malaysia, and we were talking about food, and I said something about mackerel, but it was really fishy for me. And he's like, ginger. He's like, we have an amazing dish. You just got to pile as much ginger on there as possible. And I don't know, got a little mackerel fillet and made it with the ginger, and I was like amazed. It was so great. And so there's all those, I think, ways with seafood that there's different forms, like ceviche. There's ceviche recipes in both of my last 2 books, because ceviche is a no-cook way for seafood, right? If the thing is like, oh, you don't know how to cook it, don't cook it. burn it in lime juice, add in some onions, some capers, maybe use pre-cooked shrimp, something. And so I think one lesson is start small. Another lesson is, take no thank you bites. Like I heard a great story from Dr. Sue Varma yesterday, where she's talking about she didn't like seafood, but her husband did. And so they had a rule that every time they went out, he'd order seafood and she'd try a bite. And over their relationship, she's really learned to love seafood. And I just love that story because I think it just it shows us how our palate develops. Yeah. Maybe the short answer there is mussels.
We love the long answer, by the way.
Okay,
The
mussels are a great thing to try at home. Everyone's scared, but they're amazing. I'd hold off on the big prize in this, which is the oyster. That's the top animal food on the antidepressant food scale. But those are a little challenging for people because you usually eat them raw and on the half shell. You can also do them baked, of course. Fish tacos, amazing way to start with seafood, as is ceviche. Those would be some thoughts.
And based on, and you mentioned the anti-depressant food scale, we'll get to that in a second. Based on your reading of the literature, like for folks who are like, yeah, okay, cool, I want to try seafood, or I eat a moderate amount of seafood. What is really the amount that we should be getting in based on what you've seen out there in the literature to attain some of the benefits of it?
So I would challenge people that if you think about seafood really being one of your main protein sources, that in most Americans, their main protein source is going to be chicken or beef, that if you can really get seafood in that. So I and my family in my own diet and in the book, I'm pushing for 3 to 5 seafood meals a week. That can be lox on your bagel. That can be, there's one of my favorite recipes in the book is the dashi, just because again, I try and walk the talk. I just started making this last year. I love ramen. I love noodles. I love that kind of umami healing broth, especially like when I'm anxious or upset. Just a bowl of like lots of veggies and maybe a hard-boiled egg and some, good buckwheat noodles and I didn't know what that amazing broth is. That amazing broth is dashi. It's made with bonito flakes, which is a fermented, dried, smoked tuna, and you make it with kombu, with seaweed. So it's this really high iodine, delicious broth. So it's an example of one of the things in the book, I think, that just, most folks aren't making dashi at home. And I started doing that and it became one of the things I just really began to enjoy really throughout the day. It's something that was really filling, really healthy. So I would encourage people multiple seafood meals, like 3 to 5, and then having your go-to. Like in our family, our go-to is a wild salmon. We can make a sheet pan of wild salmon. We put a little tartar sauce or special sauce or capers and lemons, and the kids love it. Salmon burgers is another one. Really easy with canned salmon. Great recipe in the book. That's once a week, once every 10 days, because the kids love it. Try and do an anchovy meal once a week because I think they're really easy and great to use, and they're so inexpensive. So much thought about this brain food is like, it's expensive elitist stuff, all this organic blueberries. And it's like, how about a $1.99 tin of anchovies and you're going to have the best brain food on the planet. So those would be some of the seafood meals that come to mind, of just really trying to rotate those in. I'm also big on wild shrimp just because those are easy for families, easy for kids, goes on lots of great stuff.
Love it. Let's talk about the food scale. So you and your colleague, take us on the story of that and how that came to be and what it is.
Yeah. So we found these 12 nutrients that Drew's asking about. And we said, all right, let's look at the USDA literature. Let's look at all of these foods, and what are the foods that have the most of these 12 nutrients per calorie. And then it's called a nutrient profiling system. At that time, there have been 27 nutrient profiling systems that have been created in the world. The ANDI is one a lot of people have seen. Remember, Whole Foods used to have that score, like kale scored 1,000, of course. That was the ANDI, the Aggregate Nutrient Density Index. So our scale, the AFS, was the first nutrient profiling system that had ever focused on brain health or mental health. And we tried to make it really straightforward and simple. We just looked at what are the foods that have the most of these nutrients. And we made the list of the most plants and the most animals and gave them a score based on, how they rated. And then the most important thing in nutrient profiling systems, it's not to emphasize a singular food. Even though we all want to know what's number one on the plants is watercress. And most people haven't ever eaten watercress. But if you look at what are in the top 10 of the plants, it's leafy greens and rainbow vegetables. You look at what's in the top 10 of the animals, it's bivalves, seafood, and organ meats. And not to say that those are the foods you have to eat to beat depression and anxiety, but those are examples of food categories that we want you to think about how they relate to your life. How often are you eating leafy greens? How often are you eating seafood and bivalves? Well, have you ever made mussels at home or had pasta vongole? And that's a way for us all to kind of engage with these very nutrient dense food categories.
And, I think the scale, it's helpful because as you go further along in the wellness journey and you are reaching a wider audience, naturally you want to have different inclusion points for them. When people are just first starting, you often, I'm sure, get the question as a doctor, just doc, tell me what to eat, right? I'll do whatever. Just tell me what to eat. So scale is nice because it gives a starting point for people. And then there's the sophisticated answer, which is like, okay, great. Let's meet you at where you're at, because regardless of what your dietary approach is, we can start the inclusion of these things. And it's really about the disclusion of the ultra processed things, because it seems like a big message that I'm getting from your book and what you talk about overall is like, sometimes it's about what you're not eating as well.
Yeah, I think the
or not eating frequently. Sorry, to clarify.
Exactly. I mean, I think there's a two-step dance in this, right? First, just cutting out processed. The reason people get better on every type of wellness diet, whether it's keto or carnivore or pegan or vegan, is that they're cutting out processed foods. That is universally true about all those diets. And it's hard to separate that benefit out from specific benefits. When you have that plus the food SIBO effect, I've joined your dietary tribe, Dhru. I think you're amazing. Now I'm following your rules. Of course, I feel amazing. Those two things account for a lot of the reasons that people get better on all these dietary plans, right? Fewer processed foods. But you're right. I am recommending that people put specific things in and not like a fancy protein powder or a supplement, or really recommending there are foods that contain these nutrients. My last book, Eat Complete, that was really my goal. And it's kind of hard, but of like, can you get all of the nutrients that you need? Can you meet the recommended daily allowance for everything just with food? And you can, but you have to focus on the foods that have a lot of nutrients. There are only a few foods that have EPA and DHA. That just fatty fish, algae has a little bit, but it's not concentrated, and bivalves. That's it. I mean, there's a tiny amount in grass-fed beef, but all the other ALA out there is plant-based. All the other omega-3 is ALA. So you asked about what foods. I wanted to answer that question. And that's why in this book, I have these power players. And the reason was I wanted to represent the food categories. So, it's not that you have to like kale, but there's a reason that kale is a great representative of the leafy green food category, because it's so nutrient dense, it's so versatile. It's so, I guess, controversial in the sense that, I don't know, people are now thinking that maybe kale isn't healthy, which is totally untrue, bad, horrible misinformation. I don't even want to start talking about it, Drew. I'm going to get too upset. But these power players, like an anchovy, they're there to serve as a kind of, not just, if you don't eat anchovies, it's fine. You can eat to beat depression and anxiety, but to serve as a real kind of perfect archetypal example of that food category. So an anchovy, high in omega, 87 milligrams of DHA in one little anchovy. You get a complete protein, B12, calcium, all these nutrients. And then, you get to usually the challenge with people in anchovies, which is they don't know what to do with them. I didn't. Do you get the paste? Do you get them in olive oil? Do you get them in soybean oil? Do you get them in water? And that's where I think people struggle to do something new, especially if we're hungry, especially if we're feeding a family. And that's where I hope the recipes in the book help people of really try and just make these foods accessible. Things like dashi, things like ceviche, things like the pesto, where no matter where you are on the kind of eater scale, there are ways that we can improve your nutrient density. And that's the hope of the book. Yeah. And dark chocolate's on the power players. Let's just say that was purely for food marketing. No, I'm kidding. Dark chocolate has amazing mental health benefits. I mean, in the literature, in the data, and it's one of, I think, a great example of how, as a psychiatrist, I want people to think a little differently about food. That I want it to be a joyful and hedonistic experience for you. I don't want dark chocolate to be like your guilty treat you get one day a week because you followed all these rules. That's not how I roll as a psychiatrist and as a food shrink. I want dark chocolate to be part of your daily existence because it's delicious, it's great for your brain, and it's packed with nutrients.
What's your favorite dark chocolate? If you want to give a shout out or a plug to any kind of brands that are out there.
A couple. I mean, I've got like 4 or 5 different brands right here with me. I like the hue, the cashew butter with a little bit of red. That's my guilty treat. That's not a solid dark chocolate, but that's just such a good yumminess. I get
They
the
did
cashew.
such a good job with that brand. It's so
really
amazing. I was an investor in that brand myself and Dr. Hyman, and they just recently sold, and just the team there, they just did a great job of just getting a better for you chocolate. Cause I think that another part of this is like, you can enjoy things like dark chocolate, especially, I mean, by nature, we're saying dark chocolate, it's going to not have a lot of other gunk, but still there's naturally greenwashing that happens in the field that's out there. So you can even find dark chocolates that they say dark chocolate, but they make that up with a ton of sugar inside. And now you're not getting the benefits don't translate exactly the same way.
Exactly. The way that my favorite dark chocolate is from the La Anita cacao rainforest kind of farm in Costa Rica. We went down there, and one of the recipes in the book, the buckwheat cacao pancakes, is inspired. I never had cacao nibs and pancakes before, and it totally changed my brunch and my life. I mean, I just love cacao nibs, but that's really, in terms of palate development. Also, a lot of people listening, if you've been, and a lot of Dhru's listeners probably are, you're off the processed food, but if you're got artificial flavoring, sweeteners, processed foods still creeping into your life, one of the nice things about the whole food journey is you develop your palate really develops. And so for me now, like a cacao bean, to chew on that is pretty close to dark chocolate in terms of my just experience and enjoyment of it, even though it's just the bean. So yeah, but dark chocolate is I think a good example of a really nutrient dense food, lots of fiber, lots of magnesium, iron, but also a food that people aren't oriented towards in a way that it's anything other than, I don't know, like the not healthy version or the not fun, what Seth Rogen called it, the not fun version of milk chocolate. I was like, that's so not true. There's like so much more dopamine you get from the dark chocolate.
I know. Dark chocolate is amazing. Let's take a step back. What is it specifically that made watercress score so high and be number one on the list? And then how is that something that you're integrating into your diet if you are?
Yeah. So watercress scored high as all leafy greens do because they just don't have any calories. So a cup of kale has 33 calories and a cup of watercress has less than that. And so when you have so few calories, that's why you're going to top any nutrition you bring to the table. You're going to top out these nutrient density scales. Watercress I've incorporated in my diet because it's a leafy green that I never ate before at all. It's very spicy. I do a lot of arugula. And then one of the fun things about this kind of work is how much you get to learn about food. And so I didn't know that watercress, for example, is a big part of a Haitian diet. And people in Haiti eat water. I met a woman from Haiti who said, we eat watercress almost every day in Haiti. And I had no idea. So that kind of led me into being curious about this food. And I can't find it that much. I always think it's a little blessing from the universe. I did an interview with our friend, Dr. Rupi, the Doctor's Kitchen. And I was out in Wyoming and I'm like looking for stuff to make pesto with. I can't find this. And there's this giant display of watercress. And so, sometimes it shows up in my life.
When I educate people about exercise in the brain, their motivation for exercise does change. And yes, it can be a combination of that fear and anxiety-based motivation. But I will talk to people that just had no idea, or they heard it was beneficial, but it was presented as a side effect. Oh, did you know that because you're exercising is also good for your brain? Cool. Thanks, Snapple fact, right? It's not really presented as this really evidence-based modality that could hopefully really move the needle for people, right? And when you present it as such, and you give a practical, stepwise, I don't want to say formula or protocol, that's I don't like those words, but you give them a process, a path forward. They can see that path forward. They're more likely to take that step. So I have had conversations with individuals that have some cognitive impairment. They're in their 70s. Of course, it's a 28-year-old millennial talking to them and telling them how to improve their brain health. So, there's some of that bias there. But, we're usually there on good terms. But there is some like, okay, what are you going to tell me, right? And I educate them about the benefits of exercise in the brain. We might have a single conversation. In some individuals, this is not true for anybody. I might check up with them or check in with them maybe 6 months later, and they've been going to the YMCA like 5 days a week, and they're like motivated and they enjoy it, right? So I've had those complete flips. I've also had individuals that maybe all they could do is add 5 minutes more to their walking routine or walk a little bit more briskly. Or I've had conversations where they were doing aerobic exercise, but they thought that was the only thing that was good for their brain. And then I talk to them about more cognitively demanding or skill-based modalities, and I bring up dance, and oftentimes I'm talking to couples. And some of the most meaningful events in my career have been, we can dance again. And they have this like sparkle in their eye, like they used to dance, and now they can dance again for brain health, and they love that. So there's a lot of ways those conversations have gone and can go. And I've had people that just don't want to change. They're not ready to change. I just give some information and maybe set it up for another conversation in the near future and say, look, what you're doing is great. Keep doing what you're doing, and let's see how you're doing in 3 months. And we come back to that, and maybe they're ready for more intensity or more duration or different modalities. So that conversation can go a lot of different ways. And I think behavior change is a mechanism. There's no one right way. I think like, oh, we'll add 5 minutes and add 5 minutes and add 1 to that RPE scale and just, keep going like that. But I don't know if that's always the right answer. But I think there is an answer for everybody.
We're recording this in the midst of social distancing. There's been a mental health crisis that's been looming in this country well before the coronavirus pandemic, but it's been brought to the forefront because there's so many more people that are struggling with their mental health because plans changing, unemployment rates as high as they are, uncertainty and anxiety with the news or information that's out there. What do you tell them? What do you tell individuals who relate to that about what role exercise can play in the midst of a pandemic?
Yeah, it's all the same people I've been coaching, just everyone's experiencing a lot more stress and isolation and, like you said, perhaps mental health issues or symptoms. I think the emphasis, it's a lot more flexible. It's not as rigid as a prescription, perhaps. It's really a combination of whatever you can do, right? Or maybe let's emphasize some of the softer elements like enjoyment. I think what it has done is really shed a light on the convenience factor, where there's this concept of self-efficacy, being able to do it on your own, right? And build up the internal skills necessary to perhaps remain consistent with a behavior like exercise, or at least have the tools and knowledge to do so. I think now that people are more, they're stuck at home and they're not able to go to the gym and maybe work with a group fitness class or a personal trainer in person. Of course, those are still available remotely. But I think the onset of digital resources is helpful for perhaps promoting self-efficacy. And I have found that people are more active on their own now than they were previously. I also think it's great because while the gym is very important, I want all my friends and colleagues in the fitness industry to thrive and survive. This ability to work out on your own at home is really important. I think it's a really important skill. It's kind of like having to go to the dentist to brush your teeth every time versus being able to brush your teeth at home. It's this critical neurobiological hygiene that people are developing better skill sets for now.
Right, because we want to again peel back away the idea that it's like a gym is like, in the early days of even church, it was like prayer happens in the church. It's not real if it's happening outside, right? The clergy is the pathway and the vehicle to get to God.
There's a lot of shared elements there with fitness, I think.
Right. And so it's great. It's good to have gyms. It's good to have these other things, but we want people to be able to incorporate it, because if we can find and have a lot of tools in our toolbox, then we can tap into that tool at different time periods, and we can have the variety of those different tools that are there.
And also things that used to be very expensive, like personal training or certain modalities of exercise, it may have been difficult to access those, are now becoming more accessible and scalable. And that might include more niche fitness modalities that maybe incorporate more skills. We can talk later about things like virtual reality and VR fitness that I fully embrace as still that gamer that I am, that I'm more reliant on during these times. So I'm rather positive and optimistic about what's going on with the fitness industry for the consumer. I have a lot of empathy for the industry, the fitness industry.
sure.
But everyone's being forced to have their digital strategy right now, right?
And mostly we've been talking about people who had to have pivot, but I think the thing is that if you weren't working out or had an exercise routine, and this pandemic has been stressful on you, has created anxiety, has created a little bit of worry, it's now is even the best time in the world to be able to step into this, to pay attention to this conversation, and to look at what does it look like to find a personalized routine that's there for you, that makes you excited, creates joy, and has you want to do it, not thinking of exercise as a secondary benefit to the brain, but as a primary intervention to have you feel better, sleep better, think more clearly, be less anxious, feel more connected to individuals potentially, depending on how
and I think the opportunity, and I use this phrase carefully, self-prescribe exercise based on how you feel. So one of the concerns I have heard is, well, because I'm not in the gym, I'm not working out as hard, as intense. Looking towards all these studios popping up that really have a focus on high intensity, which is and can be beneficial. But I think there's quite an obsession around HIIT training and high intensity interval training right now. And there's been quite a few systematic reviews and meta-analyses demonstrating that maybe moderate intensity might be better for producing improved outcomes when we're talking about depressive symptoms in people with depression, or maybe a certain frequency, such as maybe a higher frequency might be better, for instance. If we have anxiety, maybe it's time to opt for a more mind-body approach, like a restorative yoga, instead of doing that high-intensity interval training class. Now, I'm not poo-pooing those classes, but our society is rather obsessed with them right now. And I do feel that people tend to think that if they're not adhering to this high-intensity interval training, they have failed.
Or that it's not a real workout. I know for
Correct.
a long time, because I didn't grow up working out, I played a little bit of sports here and there, but I never really had a routine. Then when I became an entrepreneur and I dropped out of college, I was just on the computer all the day with bad posture, not working out, just building companies.
Sure.
And it was great for my bank account, but it wasn't good for my body.
Yeah.
And then when I started a workout routine, there was the feeling of if I wasn't like drenched in sweat, then it wasn't a real workout.
Right.
And then the switch happened as I started to get deeper into the space of functional medicine and looking at a lot of the experts that you've talked about and getting the chance to meet people like yourself. There was the idea that the primary role of these interventions is really around like the whole body feeling. It's not that if I don't sweat profusely, it doesn't count, and it's not real, and it's not a workout. I can still enjoy those things. So I would say since the pandemic, I haven't been working out intensely, right? I do the 7-minute workout from like the New York Times, and
that's high intensity because it's very
a very short period of time, but it's a very short workout. I really like it. I heard about it first from Dr. Mark Hyman, and then I've been playing a lot of tennis. And that's awesome. Pretty much it.
Yeah.
I did a push-up challenge with my buddies. we did this 100 push-up challenge, on the side. But outside of that, I have not been going and working out at that same level. But I actually feel really good. I feel really good, and my brain feels good, and it still feels like I'm doing something.
That's important. And I think what are your goals? And a lot of people are in survival mode right now. So maybe that's enough to survive right now. And maybe the goals you had, before COVID-19 are not the same goals you have right now, but it all goes with this idea of a self-prescribed or a facilitated precision medicine approach using exercise, ideally for brain health, but we could talk about, inflammatory biomarkers. Should your exercise prescription be different based on those, right? And the intensity conversation could parallel that. I've talked to a lot of functional medicine doctors that share the perspective that if you have a lot of a high level of circulating inflammatory markers like CRP, for instance, or IL-6, you probably shouldn't be doing primarily high intensity interval training. You might want to suggest more mind-body or lower intensity modalities primarily, and then kind of alternate as time goes on, for instance. So, this can be based on your feelings. It can be based on your cognition. It can be based on your motivation, your readiness to change. It could be based on biology, measured or otherwise. So that's sort of what I want to promote for people, is this self-prescribed and facilitated, because I want to speak to the practitioners, the health coaches, the functional medicine doctors, the personal trainers out there too. But both parties play a role in this, is using exercise in a precision medicine context. Because once again, I want to keep bringing it up, just like functional medicine has looked at this very detailed and nuanced long list of things to do for nutrition, let's give exercise that same treatment. And let's not look at it as a side effect for brain health and just something, oh, just do it, it's good for you. And I don't want to get on my pedestal too much with that. As you know, I'm very passionate about that conversation.
No, but it's an important thing. It's like when we have these distinctions, that's when we can have a shift in behavior to get the benefits from the thing that we're talking about. So to understand exercise, let's break down you have this great analogy that you use, and you equate sort of, you equate exercise and nutrition, right? And you kind of help people understand it that way. So talk to us about the 3 macronutrient ingredients for brain health.
Yeah, it's a fun metaphor. I'm open to better ones. But I think for the purposes of this discussion, we can talk about 3 primary modalities of exercise. The first being aerobic or cardiovascular exercise. The second being resistance or strength training. We can get into the nuances of that. And the third being motor or skill-based. And we can talk about the nuances in that. Each of those categories have their own subcategories. So for example, cardiovascular exercise might have an emphasis on intensity, duration. There's continuous exercise, or there's high intensity interval. So going up and down in terms of intensity, or going to a level of intensity and staying there, right? For resistance training, a lot of people are saying, well, does body weight count? Well, that can develop body weight strength. But what about the importance of external loads, weightlifting, which for many people is challenging during this time. They don't have access to resistance training equipment, but it's something, at least in terms of the cognition and brain health conversation, that is usually missing. It's extremely important and has differential effects when compared to aerobic exercise. In fact, a recent meta-analysis just came out looking at older adults with mild cognitive impairment and ranking the modalities that might be best for global cognition, and resistance training was the first, followed by exergaming, then by aerobic exercise, then by mind-body exercise. So that was really interesting to see. So resistance training is having its moment in research, and now and in the past few years. I think the plethora of research on aerobic exercise came from that aerobics movement and the fact that it's a relatively easier intervention to study. I digress. The third category would be skill-based or motor training, where there's something coordinative or learning characteristics associated with that modality. So there's that would include mind-body exercises that are usually not higher intensity. Of course, there's fitness elements of yoga, right? But mind-body exercise usually relating to lower intensities, things like Tai Chi, Qigong, more restorative martial arts, restorative yoga, or yoga that isn't heavily fitness focused. On the other hand, we have skill-based modalities that are higher intensity, things like sports, martial arts, dance, and each of those usually have some sort of skill element to them, in which if you did not pay attention during those modalities, you would either fail or not participate or get hurt, right? And so those are the 3 categories. So carbs, fats, proteins, aerobic, resistance, and skill-based. I haven't said aerobic is like carbs, but I haven't gotten super deep into the metaphor, but I do feel
it's just a way to understand.
Exactly. And of course, this is not sensitive to the conversations around ketogenic diets that completely dismiss carbohydrates. So I don't want it to fall victim to those biases or viewpoints.
Right. And the point of them basically is that it's an easy way to think of, that we all need
these 3 nutrients.
These right. nutrients.
Right. But I will say that people do bias themselves in those 3 categories. Usually they're aerobic people, but not resistance people. Or they're resistance people and they're in the no sweat club. They don't do aerobics. Or there's people that love their Zumba class but won't lift weights, right? And that's what I find is people automate their decisions around exercise, which is good for adherence, consistency, motivation, enjoyment, but maybe not conducive for healthy variability. And the reason we talk about healthy variability, wanting maybe 1/3 of each of them to be general, is that at least in healthier adults, both middle-aged and older, multimodal programs, ones that incorporate more than one modality, seem to be better for preventing cognitive decline than a single modality shorter intervention. So multimodal longer interventions seem to be better for this.
Yeah, and the way that you often hear it talked about, or even in my gym that I used to go to here in Santa Monica, 34 North, people would often say I don't run, right?
Yeah.
But okay, great. You don't have to run, but
how do you get that essential aerobic nutrient otherwise?
Right. Could it be tennis?
Yeah.
Could it be something else that's there as another way of getting that in? It doesn't have to be running.
That's right.
There's a lot of
I hate running personally.
I don't like running.
I will get my aerobic load from high intensity format of resistance training as well. So you can layer or stack these variables if you're pressed for time, or if you wanted to have some what I call intra variability. So intra variability would be taking that workout, whether it's 20, 30, 60 minutes, and changing the variables inside of it. Extra modality variability would be saying I do aerobic one day and resistance the next day. Both are good. There's ways of tackling this variability conversation in different ways. So if I did 30 minutes of resistance training and on the same day right after did 30 minutes of skill-based training or racquetball or tennis, that would be a multi-component exercise program. So you can do that, and most people do that. That's actually some of the fundamental aspects of circuit training, where they incorporate different modalities, where you're doing some sort of skill-based speed agility type exercise, then you go to lifting a weight, then you go to burpees, and it's sort of like that. I think there's more research needed to compare that versus, just doing 30 to 60 minutes of aerobic on one dedicated day versus incorporating modalities inside the workout. But there's a lot of ways to win once again.
Yeah, and laying back on the idea of creating joy, there's a lot of ways to win, and there's a lot of ways to incorporate it into your life where it doesn't feel like this extra thing.
Right.
For example, you had this story of talking to one of the practitioners, I think it was at the clinic, about dance.
Yeah.
And whether or not, it sounds like that from the way that I heard the story was that they're a very clinical type of person, and you had suggested, would you ever consider dance? And this individual said...
it was a patient that I had.
Oh, it was a patient.
That was actually also a clinician.
Okay, a patient that was also a clinician, but not at the center.
Right.
Yeah, so could you tell that story here?
So that individual was experiencing cognitive issues and had come to me because they were very interested in anything they could do to prevent further decline. And if you think of anyone in a position where they're heavily reliant on their intellect, any evidence of cognitive decline can be immensely stressful for them. So this person had a diagnosis of mild cognitive impairment, and they came to me because they wanted to address the exercise piece. So we worked on structuring their lifestyle to have a multimodal exercise program. So incorporating greater intensity of aerobic exercise via running. Then there was an ankle injury, so we backtracked to do more cycling with resistance training. They got a personal trainer to help them with that aspect. And they worked with me one-on-one to incorporate this more cognitive motor intervention, so cognitively enhanced exercise at our center. Simultaneously, I was trying to promote healthy sleep hygiene, as well as adherence to a CPAP, as they were diagnosed with very mild sleep apnea. And after 3 months, according to a quick cognitive screener, not a super in-depth cognitive reevaluation, but also combined with their subjective feeling about how they felt cognitively. And their baseline for this was speeches and speaking, and being able to do that fluently and flawlessly, in which they did have trouble with prior to seeing me, as well as our team, no longer had those issues, and no longer had that, according to this global assessment of cognition, mild cognitive impairment, and then therefore was considered normal, and subjectively felt a lot better, and has maintained that ever since.
Hey YouTube, if you enjoyed what you just saw, keep watching for more great content on how to improve your brain and your life.
I think new emerging data coming from the VA, and one of the things that caught me off guard was the highest rate of suicide was actually coming the first 3 years out of service. And so, kind of circling back to that point of this transition